So our last question is, what is the relevance of the role of case management in the global context? Like globally, where do you see that, or how is it reflected in other countries, or is it?
So this is a good question with us being on the coronavirus.
Oh, yeah.
Globally, what's happening globally here? How is it being handled? How are we handling it versus other nations have handled it?
Right.
So if you look at China and how they handle the coronavirus, and they had so many deaths. Now the coronavirus is here.
Right.
And people are like running and panicking, blah, 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 blah. So the health policy is making sure that certain precautions, people are educated. That's a policy that people have to be educated. They
Right.
have to be and know how to prevent the illness or the disease,
Right.
and then know how to be on what to look for if you do start having symptoms.
Right.
Being able to know, and then how do you educate a person to what's the policy to take care of yourself once you're diagnosed.
Correct.
Understanding why you're in quarantine for this amount of time because of that incubation phase.
Right.
Understanding that, and then knowing how to come about and then resume your life at a regular role.
Right.
So it's globally how things happen in one country and how we do something. Now, do I think we're in overkill with everything we're shutting down? That's a possibility.
Right.
But then again, they're based on what's happened in another country in that area,
Right.
and just not knowing how to handle it here. When in actuality, the regular flu kill more people than
What'd you say? Oh, say
the
that
regular flu.
again.
The regular flu. The regular flu.
It affects more people and it kills more people than the coronavirus.
Than the coronavirus.
So
Because children can get the regular flu, where children are least vulnerable to get the coronavirus unless it's a baby that's got some illnesses or a very young person that's got poor immune system.
Right.
But so you look at it, it's just how it affects everybody. It has done globally.
Yeah, in a short amount of time.
In a short amount of time.
It had a huge effect on the whole world. All right, so that is it for our interview on case management with Ms. Cherokee Mobley. Thank you so much for your time. I did want you to touch on your current position at Orlando Health and how you went from case management to where you are now.
So I'll try to do this in a quick synopsis. So I've only been a nurse for 5 years. I graduated in 2015. I went to work for Orlando Health in February of 2016. I started out there. I knew I did not want to go into a unit. I was really looking at my age. I was looking for something Monday through Friday.
Right.
So I got hired on in the oncology, outpatient oncology clinic there where I worked Monday through Friday. I got hired on as a float, which meant I went to all the oncology departments: surgical oncology, thoracic oncology, breast clinic, radiation oncology, medical oncology, surgical oncology, all these oncology, neuro-oncology. So I got to learn a little bit of everything, and I kind of pulled it together. And I'd done that for like a year or so, and then I got offered a position as a full-time radiation oncology nurse. I brought what I learned from gathering all the training, all the things I'd done in those other clinics, I brought it to the radiation oncology field. I then went back to school about 2 years ago to get my bachelor's degree. Graduated my bachelor's last year in April. Immediately upon I graduated with my bachelor's degree, that just opened up a whole barrage of things.
Ooh,
So
encouragement.
I'm kind of a go-getter too, so I'm just like, I want to do that. I don't have as much working time as a lot of the young people have, so I have to do everything I want to do now.
Yeah.
And I thought, case management at RMC, went into case management, knowing full well that my ultimate goal was to do navigation, be an oncology navigator nurse, but they were not hiring at the time when I didn't even have the positions open at the time. So I went right into case management, learned utilization review, learning what I needed to do to make hospital criteria meet inpatient status, or if not, how do you handle it when that happens? So then that taught me I already knew how to be well-versed, but I had to be well-versed and prepared to talk to a physician advisor versus a attending physician, or vice versa, and how I bring that information together. Because one can say yes, the patient needs to say, the physician advisor can say, I can't justify it, we can't justify it.
Right.
So you have to know how to bring those two together and do it in a most professional manner. So that's how we did that. And then just here recently, they opened up the oncology navigator role, and I just knew that was where I needed to be. I applied, got hired right on. Loved it, got promoted, accepted the position, got promoted into the colorectal clinic. So I am the only colorectal nurse navigator for all of Orlando Health, which means I cover the downtown clinic, I cover the satellite clinic here in Claremont, I cover the clinic in Dr. Phillips, as well as the clinic in Ocoee. I cover all those clinics. I don't necessarily go to the Lake Mary Clinic. I reach out to that navigator that's there. If there's a patient with a colorectal diagnosis, and it has to be a colorectal diagnosis, a definitive colorectal, I help that patient along the way.
Okay. Wow, that is huge.
And that's making sure all the principles, everything for that patient is lined up, it's done, all of that patient's needs are met, all treatments are done according to plan. If somebody's supposed to have chemo radiation, a treatment it's done together,
Right.
my job is to make sure that it's done together. It don't start where a patient has chemo, 3 or 4 cycles of chemo, and the radiation.
Right.
That doesn't happen that don't happen on my watch.
I know that's right. Well, again, I thank you so much for taking time out of your very busy schedule and doing this interview for me. You have been, I have seen you just explode in 5 years.
In 5 years.
It's been amazing to watch. So,
and I look at what I'm doing now, the job I'm doing now as oncology nurse navigator. All of the navigators have been nurses for years.
Yeah.
Nurses for
years.
years.
You have literally.
And that favor has just shined upon me, and I've been blessed with that gift where I can learn it, and I do it, and I try my best to excel at it.
Yeah.
And then sometimes you just have to know when you need to excel and you need to level up and do it. So you just do it, and you're going to do well.
Thank you.
Yes.
Thank you. All right, you all.
I have a
That's
question.
it.
I was about to say, thank you for being here for Miss Cheese.
You want to be in the video so bad.
She want to be in the video.
I wanted to choke her.
She want to be in the video. Do you need it back?
Choke her.
Do you want me to keep this in case you need to ask me anything? You can text me something if you need me to. Text it out, or just send me an email.
That's it for today.
Send that to you.
That is it for today.
You
Bye bye.
Thank you so
did
much.
it. You did it. Yeah, we did it.
You did good.
I just have to get
Thank
this
you.
over to my teammates. So put it all together.
Tell her she better do what she wants to do. Don't leave that hanging.
You hear me?
Don't leave that.